Yes, good afternoon, everyone. Like Dr. Violet said, I'm Dr. Tuta, a first-year SHO, Pediatrics. I'm going to run you through a second case of a patient who is currently in Ward 11. And the initials of her names is AR, 12 years old, female, from Tororo. She's a Japadola, and was admitted on 14th of this month. The presenting complaint is inability to walk for the past 2 months. With the history of presenting illness, the child initially started with weakness of the lower limbs, which was gradual, and that was 18 months ago. He would walk short distances, but stops. Just like after 10 meters, he can stop. And he also developed these involuntary jerking movements of the limbs, and it reached a moment whereby he could not stand or even sit. And also had confusion, would talk meaningless sentences, had hallucinations, which the mother described as probably the audio or sometimes visual, and would also forget. You would send him somewhere, her somewhere to go and take something, and she forgets, like, what did you send me? But now, very irritable. The patient also has had a gradual and progressive loss of speech. Would initially speak well, but later went on like making some few words, and currently even wouldn't talk at all. Within the 2 years of illness, the patient had also the stool and urine incontinence, which worsened. Initially, the mother would try to, she would walk along, and the mother would try to, she said like it was initially less, but now it was like worse. There is no history of any vomiting or abdominal pain or any urinary symptoms. Now, when the child got sick 2 years ago, it was just early morning when the mother had gone to the garden, and then they told her, like, your child has failed to go to school. And the child was taken to hospital in that same morning, received some IV fluids, which the mother doesn't remember, and given some medicine and returned home. So has been attending clinics at Mufumi Health Center, being given the clonazepam, being given was being given phenobarbital, carbamazepine, and phenytoin. It was treated as epilepsy. But on review of systems, the child didn't have any ear discharge or any nose. To be honest, like the review of system was unremarkable. All the systems which are to be reviewed. This is the second admission. The first one was at 1 year and 6 months, when the child had a severe illness of measles. We tried to inquire of really whether it was measles or not, but the mother reported a rash on the patient. Even the sibling, the young sibling, also had the same illness during the same period, and the child had fever. In fact, it was a severe illness because it complicated with even pneumonia. Was admitted for 3 months. So after that was managed. Initially, was managed by herbs, using herbs, smearing some oil on the skin. But later they went to the hospital when the things became worse. So later was being managed as, like I told you, carbamazepine and phenytoin at the clinics. Was getting a refill every month. Every month would get a refill. On the pre-natal and postnatal history, the mother says to have attended clinic 4 times, received all the injections of tetanus and hematemics, had no any febrile illnesses. Delivered at term, though at home, was assisted by the mother-in-law, and the baby delayed to cry, cried around after 7 minutes, after the mother-in-law stimulating on the head. Then after 5 days, they took the child to the hospital to get immunized with the vaccines. So even the patient wasn't weighed, the child wasn't weighed. Mother and baby were well, peripartum period. Immunization history, Though the mother didn't have any documentation at hand, she recalled that the child received, at the 7th day, like I told, 7th day of age, received the injection, which we even confirmed with the BCG scar. We also confirmed that at 9 months also was injected with the measles, and also got other in-between immunization vaccines. The growth and developmental history, this is a child who was well before the illness, stood at 1 year, started school at 5 years, went even up to P4, up to P4. The mother reports that the child was doing well in class, top 10, before the illness started. Nutritional history, the child would feed on an adult diet with 3 meals a day with a balanced diet, protein, carbohydrates, and micronutrients. Family social history, the mother is 30 years of age, married to a 34 years of age husband, staying together. They are all peasant farmers, and she's the first wife, though the father married another wife meanwhile, but not because of the illness, during the illness, it was before the illness. And this child is the firstborn of 5. The secondborn is 9 years, and the lastborn currently is 2 years. They're all doing well. The father is an occasional drinker and doesn't smoke. There's no history of any illness like epilepsy or any diabetes or hypertension in the family. In summary, I'll present to you a 12-year-old female who had a gradual onset of body weakness with involuntary movements, aphasia, stool and urine incontinence with inability to stand or sit, with a history of measles infection at 1 year and 6 months of age, but was fully immunized by the mother's recall. On general examination was a school-aged female, sick-looking, with jerking movements, drooping of saliva, with fingers. She would put the fingers in the mouth, all of them. She wasn't pale, no cyanosis, no obvious deformities, no finger clubbing, febrile, with no any skin lesions. In the CNS, the child was conscious. I'll have to explain here. The child would obey command, would also is spontaneous, but the verbal would hardly utter any word. Yeah, would hardly utter any word. So I just gave it 1, but it wouldn't utter any word. It had a soft neck with no any sign of meningirritation. Pupils were equal and reactive to light. The cranial nerves that I examined, 2, 3, 4, 5, 6, 8, were all, 8 and 9 were normal. The rest were unable to assess because of the condition of the child. The sensory exam, the child would respond to pain and touch. So the motor exam, the muscle bulk was reduced, generally in all the limbs. Sorry, there was, I had written there's left limb, right, lower limb, upper limb, all the limbs was reduced. The child also had hypotonia in all the limbs, and the upper limbs seem to have more power, at least power 3, but the lower limbs were powers more reduced. And the reflexes had hyperreflexia in the upper limbs, but reduced reflexes in the lower limbs. So the other systems on examination, they were essentially normal with a normal respiratory rate and no signs of any distress. Per abdomen, the abdomen was of normal fullness, not tender, no any palpable organs, but the sphincter, the anal sphincter had lost tone. And the cardiovascular also seemed normal with no any signs of shock and no murmurs. Even the musculoskeletal system also was normal. So my impression was of a school-age 12-year-old female with dystonia, subacute sclerosing panencephalitis, given the history of measles in the earlier age, and then presenting with the neurological deterioration. And also we thought of an idiopathic myoclonic epilepsy, since this could be another type of seizure disorder. Yes. And Panencephalitis and Guillain-Barré syndrome. So we worked up of this patient to the CBC. Like you can see, electrolytes and EEG and brain CT. Though others we are still waiting for results. I'll move you through the CBC seems to be normal. These are the EEG findings. I don't know whether it's not good, but I'll just tell the report. The report said there was a high voltage slowing of the background activity with periodic epileptiform discharge, which are typical of subacute sclerosing panencephalitis. We also went ahead and did a CT scan, which showed, without contrast, the hypodense areas in the frontal area, the cortex, and because of time I have to go fast. But those lesions which are hypodense didn't enhance with contrast. Okay? And also, there was also signs of edema. So the conclusion was infarct and cerebritis. It was a provisional report. So management in the ward, on admission of the patient, we had to stop carbamazepine, we stopped phenytoin, which the patient was on, then we started on clonazepam, 0.5 milligram OD, and then Aten, 2.5 milligram. In the ward, the one and the two, the patient still had the jerky movements. We did the CBC and EEG, and was started on clonazepam and Aten. Yeah. So even we had to consult the neurologist, also had to see the patient. Yeah. And at the end, we decided to stop Aten. Okay. So our working diagnosis in the ward is subacute sclerosing panencephalitis. Thank you so much for the attention.